So coming in at number 3 on our list is back pain, and by far the most common cause of back pain is a back strain. But let's just talk about some more serious causes of back pain, because sometimes back pain can be an infection, it can be a fracture, it can be cancer, it can be an abscess, it can be other things like what we call cauda equina syndrome, which is where you basically have an impingement on your spinal cord and you lose your ability to control your bowels and bladders, and you have weakness and numbness in your legs. Those are not your typical, ooh, I tweaked my lower back.
They're a different type of pain.
We actually have back in our procedure room right now Dr. Justin Paquette. He specializes in back and spinal surgery. He's here with our patient, John, who himself is having severe back pain. So, John, what kind of symptoms have you been having?
It's been going on for about 3 years. I injured my back at the gym. I was doing squats kind of improperly, but a little worried. I have some numbness in my toes, and it's always kind of there, and I'm always aware of it.
And we'll check back in just a bit, okay?
All right.
Great. Now, earlier in the show, we saw Dr. Justin Paquette begin a back exam. Dr. Paquette, what did you find?
Well, fortunately, I'm happy to announce that our patient, I think, is going to survive the day.
Yeah.
So we're doing well.
He looks too healthy.
There are a few findings in his examination that we're going to want to work up. Number one, he's got a little bit of fullness on the ribs on his right-hand side. And I do suspect he's got a very subtle curvature to his spine, maybe been there his whole lifetime. But he does have some numbness underneath the bottom of his right foot, which is probably related to one of the bottom nerves in his spine getting irritated from some degenerative changes in his back. And so at this point, our next step would be to get an X-ray, kind of take a look at the structure of his back, the dynamics, and get him onto a very strong physical therapy program, anti-inflammatories, and some ice.
Thank you so much, gentlemen. Good luck to you, John.
Thank you.